When you're older, you may notice an itch that just won't go away. You've had your skin checked. There's no rash, no spots, no cancer, no disease in the liver or kidneys. All the tests are fine. And yet, the stitch is still there. It comes, it goes, and sometimes in one spot, sometimes in an area, and sometimes all over. For many people, it's right between the shoulder blades and down on the shins. It's unpredictable. Some days nothing, and then out of the blue, it drives you crazy. And let me say this straight up. You are not imagining it. You are not making it up. As a skin cancer doctor for over 30 years, I'm very familiar with this issue. This kind of itch is real, and it's incredibly common in older people. I know it can be distressing and frustrating, especially when you feel ignored. Too many, too often, patients tell me that they've been told, your tests are fine, there is nothing wrong. As if that should be the end of the story. But you and I know it may not be dangerous, but it is interfering with your comfort, your sleep, and your daily life, and that matters. I quite understand. Doctors even have a name for this. They call it pruritus or pruritus of the elderly. Pruritus, pruritus of the elderly or pruritus of the elderly. But here's the truth. Many doctors can call it by its name, but they don't exactly know or able to explain what's actually happening. They may reach for a prescription, usually a corticosteroid cream or an antihistamine, neither of which usually helps. And part of the reason is that many don't stop to think through or explain the underlying why. They focus on the fact that your tests are normal, but they don't explain the changes in the skin itself. Without that explanation, you're left feeling dismissed and without answers. The other common advice that you get is moisturize your skin. Just moisturize. Moisturize more and more. So let me explain it in plain language. Yes, you do moisturize your skin. As we age, our skin changes. It gets thinner, it holds less water, it loses some of its elastic tissue and makes the skin less springy. The oil glands gets tired and produce less natural oil. And that means two things. The skin dries out more easily, and the nerve endings underneath have less padding between them and the outside world. Imagine a set of wires that used to be wrapped in a thick protective covering. Over time, that covering wears thin. The wires are now closer to the surface, more exposed. They spark more easily. That's what's happening with your skin nerves. Every time you move, stretch, or your skin rubs against clothing, the shearing forces aren't buffered or absorbed the way they once were. The dryness and thinning make those nerves more irritable, more likely to send an itch signal, even when nothing obvious is wrong. Now, here's the catch. When the itch strikes, your natural instinct is to scratch. And yes, scratching can give a few seconds of relief, but it almost always makes things worse. It irritates more the nerves, and so the itch comes back stronger. On fragile older skin, scratching also risks tearing the surface, breaking the barrier, and opening the door to infection. Some people even find their fingers drawn to the same spots, the same lesions, again and again because they feel something there. That makes the cycle harder to break. At night, when you don't even notice you're scratching, gloves can help protect the skin. The real answer, though, is not to scratch, but to soothe and protect the skin. And in part 2, I will share some tricks that make this a lot easier. And this is important. That's why this itch isn't caused by histamine, like hay fever or hives. So antihistamines usually don't work, don't help, except maybe to make you drowsy at night. And steroid creams, corticosteroid creams, they work on inflamed rashes. But here's there's no inflammation. And long term steroids actually thin the skin even more. So they're not the answer. The real solution is about looking after the skin barrier. Moisturizing isn't just about comfort, it's about replacing what your skin has lost. Creams are lighter and easier to use, but they don't last as long. Ointments. Ointments are greasier and messier, but they seal in moisture far better. Vaseline, lanolin, emu oil. So lanolin are the product of sheep on their skin and wool. Emu oil is the same. These can act as simple barriers. And there are newer products now with ingredients that actually replace the molecules your skin is missing. Ceramides. Ceramides are one example, natural fats that normally help lock water into the skin, but the levels fall as we age. So moisturizers with added ceramides help rebuild that barrier. Another, nicotinamide or vitamin B3. B3 is another ingredient that helps the skin repair itself and hold water better. Others, urea and lactic acid, also draw moisture in and keep the skin softer. So, the message of this first talk is your itch has a reason. It's not just old age, it's the thinning, the dryness, the reduced oil and barrier molecules that make your skin more fragile and your nerves more sensitive. And that means the first step in managing it isn't steroids and it isn't antihistamines. It's restoring moisture, protecting the barrier, and using the right kind of emollients. One last thing I want to mention before we finish today. Stress and anxiety, they don't cause this itch, but they can make it worse. If you are already tense or not sleeping, your nervous system is wound up and every sensation feels stronger, including the itch. It's like turning up the volume. So calming both the skin and the mind can help break that cycle. In part 2, I'll share the practical tricks. How to reach the middle of your back if you live alone, how to make cold creams more comfortable in winter, which over the counter anti itch creams can give relief, and a clever way to deal with those stubborn little spots your fingers cannot leave alone. So stay with me. The next part is where we get practical. See you soon.